Over 60? These vegetables raise stroke risk overnight, doctor explains. It's a startling reality for many individuals over the age of 60. A healthy lifestyle and meal choices can, unexpectedly, pose a risk to brain health. While we often associate threats with processed foods, the truth is that some very common vegetables, long considered allies to our well-being, can subtly increase the danger of stroke, particularly when consumed by an aging body. This isn't about eliminating these beneficial foods, but rather understanding how our bodies change with time and how certain foods interact differently as we get older. The key lies in awareness, recognizing that what was beneficial at 40 might require a different approach at 70, especially when combined with common medications or eaten at certain times of the day. The good news is that embracing this knowledge allows for continued enjoyment of meals while actively protecting your brain and maintaining independence. Exploration uncovers 9 everyday vegetables that, if not consumed mindfully after 60, could quietly elevate stroke risk, and more importantly, offers guidance on how to incorporate them safely and intelligently into your diet. Spinach, often lauded as a superfood, presents a dual nature for those over 60. For years, we've been told of its benefits, from building iron to strengthening muscles. Indeed, spinach is packed with essential nutrients like magnesium, fiber, and antioxidants beneficial for heart and bone health. However, the crux of the issue for seniors lies in its high oxalate content. While younger kidneys efficiently process these compounds, aging kidneys are less effective. When oxalates from spinach bind with calcium, particularly when calcium and vitamin D supplements are being taken for bone health, they can form tiny crystals. Over time, these crystals can accumulate in the bloodstream, narrowing the small vessels that supply the brain. This gradual restriction of blood flow and oxygen can create a perfect environment for a clot to form, potentially leading to a silent stroke. Therefore, it's advisable for those over 60 to consume spinach earlier in the day, such as at breakfast or lunch, when the body can better process it, and to discuss its consumption with a doctor if taking calcium or vitamin D supplements, or if experiencing kidney or heart issues. Moderation is key, and an occasional serving is generally safe, but consistent high consumption, especially in the evening, can be problematic. Broccoli, a long-time champion of heart health, also carries a hidden risk for seniors. Its richness in fiber, antioxidants, and vitamins makes it a dietary staple for many. However, the vitamin K content in broccoli can interact significantly with blood-thinning medications commonly prescribed to older adults, such as warfarin or aspirin. Vitamin K plays a crucial role in blood clotting, and while beneficial for younger individuals, it can interfere with the delicate balance of blood thinners, potentially leading to excessive clotting and an increased risk of stroke or heart attack. Inconsistency in broccoli consumption can further complicate this, making medication effects unpredictable. The recommendation for seniors on blood thinners is not to eliminate broccoli, but to ensure a consistent intake and to maintain open communication with their doctor. This allows for appropriate adjustments to medication, ensuring that this nutritious vegetable can be enjoyed safely without compromising cardiovascular health. Romaine lettuce, a refreshing staple in many evening meals, can also pose a subtle danger for seniors. Its natural diuretic effect, which encourages water release from the body, can be problematic for older adults. As we age, our body's thirst signals weaken and fluid regulation becomes less efficient. Consuming romaine lettuce, especially in the evening when fluid intake is naturally lower, can lead to dehydration. This dehydration thickens the blood, making it more prone to clotting. When this thickened blood flows through the more fragile arteries of an aging individual, the risk of a clot forming and obstructing blood flow to the brain, leading to a stroke, increases. Therefore, seniors are advised to enjoy romaine lettuce earlier in the day, such as at lunchtime, and to ensure adequate hydration throughout the day, particularly if taking blood pressure medications or diuretics. Raw carrots, perceived as a healthy and guilt-free snack, can also present a risk for seniors, especially when eaten raw and in the evening. Their quick digestion leads to a rapid release of natural sugars into the bloodstream. For older adults, particularly those with pre-diabetes or type 2 diabetes, this can cause significant blood sugar fluctuations. An evening spike, followed by a crash during sleep, can trigger the release of stress hormones, causing blood vessels to tighten and blood pressure to rise. This, combined with potential overnight dehydration, creates a pro-clotting environment, increasing the risk of stroke. To mitigate this, seniors should opt for cooked carrots or pair raw carrots with protein or healthy fats to slow sugar absorption. It's also advisable to consume them earlier in the day when the body's response to blood sugar changes is more robust. Garlic, celebrated for centuries as a natural remedy for numerous ailments, including heart health and immunity, carries a significant risk for seniors when combined with blood-thinning medications. Garlic possesses natural anticoagulant properties, meaning it thins the blood. While this can be beneficial on its own, when taken in conjunction with prescription blood thinners like warfarin or aspirin, it can excessively thin the blood. This makes fragile aging blood vessels vulnerable to bleeding, and a bleed within the brain can have devastating consequences, leading to a hemorrhagic stroke. Seniors taking blood thinners should consult their doctor before incorporating garlic supplements into their diet, as even moderate amounts in supplement form can create a dangerous interaction. While cooking with garlic is generally considered safe in moderate quantities, the concentrated effects of supplements are a serious concern. Onions, a foundational ingredient in countless dishes, offer significant health benefits with their antioxidants and anti-inflammatory properties. However, for individuals over 60, onions can subtly impact blood pressure and circulation, particularly when consumed raw or in large quantities, especially in the evening. The compound quercetin in onions acts as a vasodilator, widening blood vessels. While this can be helpful for younger individuals, in seniors, especially those on blood pressure medications or anticoagulants, this effect can be amplified, leading to an excessive drop in blood pressure. This can reduce oxygen delivery to the brain and, in some cases, trigger a reactive constriction of garlic blood vessels, potentially promoting clot formation. To enjoy onions safely, seniors are encouraged to consume them in cooked forms, in moderation, and preferably earlier in the day, allowing the body's circulation to be more robust. Corn, often perceived as a simple, sweet vegetable, behaves more like a starch in the body. This means it's rapidly converted into glucose, significantly raising blood sugar levels. For seniors, who often experience slower insulin responses and reduced circulation, this rapid sugar spike can be particularly problematic, especially when consumed in the evening. The subsequent blood sugar crash during sleep can trigger a surge of stress hormones, leading to tightened blood vessels and increased blood pressure. This, combined with the blood-thickening effects, creates an environment conducive to clot formation, raising stroke risk. Seniors, particularly those with diabetes or cardiovascular conditions, should be mindful of their corn intake. Pairing corn with protein or healthy fats and consuming it earlier in the day, rather than as a nightly staple, can help manage its impact on blood sugar and circulation. Asparagus, often viewed as a light and healthy choice, is a natural diuretic. For seniors whose kidneys may be less efficient at regulating fluids and whose thirst signals can be weakened, asparagus's water-releasing properties can lead to dehydration. This dehydration thickens the blood, increasing the risk of clot formation, especially in the delicate blood vessels of the brain. This risk is amplified when asparagus is consumed at night, as its diuretic effect continues during sleep when fluid intake is minimal. To safely enjoy asparagus, seniors are advised to eat it earlier in the day, ensure adequate hydration, and consult their doctor if they are on diuretics or blood pressure medications, as asparagus can intensify their effects. Tomatoes, a cornerstone of healthy eating for many, can also present a hidden risk for seniors. Belonging to the nightshade family, they contain compounds like histamines, tyramines, and solanine. These can trigger inflammation, cause unpredictable changes in blood vessel diameter, and even elevate blood pressure in sensitive individuals. The acidity of tomatoes can also interfere with essential electrolytes like magnesium and calcium, which are crucial for stable nerve signaling and vascular tone. When these effects accumulate in an aging body with more fragile blood vessels, it can mimic stroke-like symptoms such as dizziness, blurred vision, or numbness. This phenomenon, often referred to as a stroke mimic, is particularly concerning for seniors who consume large, tomato-heavy meals late at night, combine them with other nightshades, or are on medications affecting blood pressure or circulation. To mitigate these risks, moderation, cooking tomatoes to reduce solanine levels, and consuming them earlier in the day are recommended. Ultimately, the most critical takeaway for any individuals over 60 is that awareness is the most potent medicine. While the advice to eat more vegetables has been a lifelong mantra, it's crucial to understand how our bodies evolve with age. Changes in kidney function, blood vessel elasticity, hydration needs, and the presence of medications significantly alter how we process food. A meal that strengthens us at lunchtime might subtly endanger us at night. Natural remedies can become risky when combined with prescriptions. Even seemingly benign snacks can disrupt our sleep and circulation. This doesn't mean abandoning healthy eating, but rather adapting it with knowledge. Simplifying choices, prioritizing whole foods, timing meals wisely, staying hydrated, and engaging in open conversations with healthcare providers are all vital steps. By understanding these intricate food-body interactions, seniors can empower themselves to make informed dietary decisions, protecting their memory, independence, and overall well-being, transforming aging into a period of wisdom and thriving rather than decline.